Well, thank you, Dave, and thanks everybody for joining us. We're in the home stretch of this day filled with insightful goodness. I'm really excited to see you all. Since we're talking about wellness, I just wanted to take a moment, if you will, indulge me. Let's all take a big, deep breath. Let it out slower than you brought it in. Nice. Resets the parasympathetic nervous system, makes you a little bit more receptive to what you're going to hear. So I just wanted to start by saying it's funny, not in a ha-ha way, but a little sad that we're still talking about burnout, anxiety, loneliness, lack of motivation, after what appeared to be an all-time high a couple of years ago. And here we are, and no matter where you are on the political spectrum, you can also throw in a generous pinch of election anxiety, I'm sure, into that boiling cauldron of malaise. For those of you in HR, L&D, DEI, you're our frontline heroes. You're bravely trying to at least keep it down to a simmer. Thank you for indulging me for that metaphor. But for the most part, you know, your efforts haven't gone to waste. There's evidence from Gallup to SHRM to the American Psychological Association that efforts to improve employee well-being, say that 10 times fast, impact productivity and retention up, absenteeism and healthcare costs down, and the bottom line, more profits. So what's the next step in this journey to improve workers' well-being? Here to discuss, we have 5 people who've got their sleeves rolled up. They're diving in daily. I'm going to ask them to introduce themselves briefly and tell us one benefit or initiative that has boosted your own sense of well-being. Start with you.
Good afternoon, everyone. I'm Ebony David. I'm a Vice President of Human Resources at Quest Diagnostics. And I'll share one gem that was shared with me as we were building our wellness strategy. It is sitting is the new smoking. And so I move all the time. And I'll talk a little bit about, we create mobile meetings. You put a meeting on the calendar and you tell everyone to hit the road, get on their AirPods and take a walk. And that's what I do.
Amazing. Thank you for sharing that. Ralph?
Hi, everyone. I'm Ralph Nader. I lead talent for the US for IPG Media Brands. So we're in the agency media world. One of the things for me was really the flexibility in the application of the return to office policy and sort of the humanness behind it. That's probably one of the things that's been most helpful in my own sort of journey back to the office, if you will.
Flexibility is a benefit, for sure. Thank you. Ivy.
Good afternoon, everyone. I'm Iveles Mendez Justiniano. I go by Ivy, and I'm Vice President and Chief Diversity, Equity, and Inclusion Officer for New York City Health and Hospitals. That's a mouthful, so I'll take another breath.
There's 40 minutes right there.
Yes, absolutely. And one of the initiatives, and I actually like to choose different initiatives. So this month I'm looking at adaptive yoga. So it's one of the many offerings that my organization is putting out. And last month I was doing plant-based dieting.
Great. Thank you for sharing.
My name is Jim Gallick. I'm the Senior Vice President for Personify Health. We used to be known as Virgin Pulse, having rebranded earlier this year. We're fortunate because we serve close to 4,000 or 5,000 employers and work with them on their well-being strategies. So we're able to see a wide variety of programs that work. And I would say the key metric for us, or the key thing that makes a difference, is personalization. In this day and age, everything wants to be personalized. Our social media feeds, they are really personalized to us. And so we think about well-being not just from a general construct, but at a personal level. How can we make each person feel like this is built for them? It's a pleasure to be with you today.
And wait a minute, you're not free yet. What is your personal thing?
So for me personally, it's a little bit weird, but I work from home. And at the end of the day, I get out and I walk around our yard or around the block, and I come back through a different door. And for me, that's the break between my work life and my home life.
That's a great hack.
I love that. Yeah, I don't work from home because I can't do the break. I'm all in.
Yeah.
Katie.
All right. Hi, everyone. Katie Egan. I lead DoorDash for Business. We feed your team. And if we don't, we will. So call me later. So I don't work from home because I have a stay-at-home husband and 2 little boys, and that's chaos. So I go to work every day, and we get a $20 meal credit for lunch, and I get to order on any restaurant I want on DoorDash. And that sounds, like the bottom of the pyramid for folks who are in Bree's session earlier, right? Just basic needs, food. But it's actually more than that for me. So in the morning, my husband's making lunch for my 2 kids. I don't have to make my lunch because I've got lunch at work. I'm hanging out with my 2 kids. We're playing Mario Kart. We're doing homework. I'm getting them dressed. They're getting out the door. And on my way to work, I order my food and schedule it, because once I get to work, I'm 10 to 6 in meetings the entire day. So then I'm not hungry when I'm ordering my lunch. I make a better choice. I'm healthier. My lunch also comes at 10:45 because I got up at 5, so I'm starving by like 11:30. So then I grab my food between meetings and I'm not hangry, which makes me a better boss, I hope. I paid them to say that. So it's actually really important, even though it is, not that expensive of a benefit for our company, right? I probably, let's say I never traveled, that's like $4,000 a year that DoorDash is spending on me, but it's actually like the most important $4,000 to me and my day-to-day health.
Yeah, absolutely. Hangry is an under-discussed
It's real.
Yes, it is. We can come back to that. I want to do a speed round now, if you'll indulge me. Just a table set. How are your organizations defining well-being, and what benefits fall under that umbrella? You don't have to get too specific, just kind of give me a broad overview. So back to you, Ebony.
So we're looking at our whole employee, not just who they are at work, it is who they are at home, it is what's happening with them and their family. And so that falls under our medical benefits, it falls under our return to office policy, it falls under flexibility, and it falls under the new competency we are looking for in every leader, empathy. Empathy is key in this world today.
Yeah, I think that's an interesting question, because I think if you look over the last 5, 10, 15 years, the evolution of the workforce and the inclusion now of sort of the home life, and something that the employers are also helping out with more and more and more, I think is a sort of direct product of COVID. I think for us, we really look at it as work-life balance as being part of the well-being cycle, health, and mental health. I mean, those are really the 3 sort of key elements, and tries to get the full spectrum of the individual.
Ivy?
So I'll add to those, and I'll put in, we're looking at it from the employee equity perspective. So we're looking at the whole employee, but we're also looking at food insecurities. We're looking at socioeconomic statuses, how we can involve our employees, how we can move them from one level to the other. And then again, everything else that everyone else has said.
So I'll take it and I'll raise it 1 bar higher. So as an organization that provides well-being services to organizations, it's kind of our corporate structure and our corporate strategy. So literally everything that we're doing is built around the employee, primarily because we've seen a direct correlation between how well we treat the employee and how well they perform. And so for us, it literally goes back to, from our CEO down to the individual line workers, how do we make their lives easier, simpler? How do we live a more personalized life? How do we reach out with empathy and meet them where they are? Looking across multiple axes, including financial, physical, emotional, social connections, community well-being, family well-being. All of those things need to come together and work really well for that person to come in with the ability to give more than what they're taking out. And that's ultimately at the core of well-being, is can you have enough that you can give of your excess without depleting your reserves? And for us, that's our definition of well-being.
Cool. We also consider the whole spectrum of benefits, right? To do your best work, you really need to be able to be your best self holistically. I liked what you said earlier about personalization. So I think the other key principle for us is flexibility. And that's both in terms of individual choice. So we're constantly trying to thread the needle of what is enough choice that you can opt into what is really relevant for you without me needing to spend as though everyone is opting in at 100% of everything, because budgets are real. But then it's also about flexibility from a team and function standpoint. So we try to not have too many company top-down mandates, because we've got account executives who are on the road all the time. We have call center employees who really benefit from being together and learning from each other. We've got product teams that come together for big sprints, but then kind of go away to build by themselves. And so we try to be flexible both from a company policy standpoint and also a benefits packages standpoint.
So I'm hearing empathy, flexibility, personalization, all of these things that really we weren't talking about much before 2020, which is really kind of an evolution in a microcosm here. Jim, you have an interesting perspective because you're seeing internally and externally. So I'm just going to ask you, what trends are you seeing while we're talking about evolution, both from clients and within your organization? Has anything radically changed?
Yeah, so great question. In terms of overall trends, if we look back 2019, I think Dave even told that story in terms of well-being being kind of the doorknob conversation as we're wrapping up a conversation. It is now the start of every conversation is around well-being. So that's one of the key components. The second is around personalization. And how do we make it very personal? Because if it's not, they're not going to engage in it. It's not going to have meaning. So where there's personalization, there's meaning. If there's meaning, there's hopefully good outcomes. And then I would say we did a lot of spending as organizations during the COVID years, trying to figure out what worked and what didn't work. And we were willing to try a lot of new things because we just didn't know the environment. Exiting that, we hear from a lot of our clients saying, I think it might be time to simplify things and make it easier. So where can we consolidate some of this overlap in terms of the different programs or vendors? How can we make it easier? How can we put people in one place to go so that they're not trying to jump around from one site to another, one resource to another, to really find the thing that is meaningful for them? So those are just some of the trends.
Well, did you want to?
I agree with all of that. Also, as an employee, I was talking to some people today about a mental health benefit that I should take advantage of, but I just can't get through the call to action, which is register. I'm just sounds like homework. The other trend that I think is we have to talk about is the cost side of the equation, right? The world is different today from a budgets and what investors expect and what the street expects standpoint, even more so than 2 years ago post-COVID, right? Mm-hmm. So the thing that we are trying to do is say, hey, what are the benefits that are really valued by your employees? And how do you essentially deliver those at the lowest possible cost? So one of the things that we've found is that 90% of employees with a meal benefit program report being more satisfied with their job. So it's, again, a relatively low cost way to get people happy, not just across feeding themselves with other things. It's not just meals, right? You can survey your employees, but the data, employees are really happy to talk about it. Mm-hmm. They have a lot of opinions about benefits, about food, but about other things too. And so I think the goal is just to make sure that you have that touch point, because sometimes what the executives, what we want is not actually in line with what the troops need. And so if we're designing for ourselves, we're really missing an opportunity to do what we're trying to do, which is high ROI benefits for the whole team.
Well, I love that you brought up the cost part of the equation, because what I've been hearing over the last couple of years particularly are employee resource groups, business resource groups, whatever you call them, as sort of being this, under the radar, under the iceberg tip, if you will, way of influencing how benefits come up, what people need. So, Ebony, I want to come to you with this question. What have you seen in terms of how ERGs are influencing the employee's quest for better well-being?
So it goes actually to what Katie was saying as well. When you talk about spending money, we all have less to spend. And I think we put our money where our mouth was. Last year, we actually launched our 11th EBN called Healthy Quest. And we put a full-time person. So for every other EBN, it is a part-time job to your 1 or 2 full-time jobs.
Volunteer.
For Healthy Quest, we've actually committed a full-time resource that runs the EBN. And so that incorporates, in the last year, we have over 1,200 employees that have joined, but they do programming and initiative across the enterprise. So the last initiative we did was a team challenge where we encourage people to create a team and see who could get the most steps in 30 days. Let me tell you, the back of our parking lot was full before the front of our parking lot. We saw the changes people were making.
Yeah.
But it's, giving mental health benefits. So we have a program with a third party where we offer mental health benefits to all 57,000 of our colleagues, free of charge, 6 sessions for our employees and their family members. What's really pivotal about that program is if you are in crisis, we will get you help within 1 hour.
That's incredible.
If you are not in crisis, 1 week. And you get to pick your provider. Because what we heard in 2020 and 2021 is people needed the benefit, but were calling and being put on a wait list or being told they didn't have time. And you had people, if not at crisis, really near crisis, and then got into crisis, and now they're in an emergency room and not being able to be treated properly. So we've put the money into this EBN, and it is paying for itself. We're also looking at our medical plan of how we're making people healthier. So I talked about the mobile meetings. In our labs and our offices, we have put walkways with the distance, so you know how far you are walking. And so it is not uncommon to see a person 3 times, right, on their, in our hallway.
Doing the laps.
Doing the lab. So, making it part of what they do. And when you have a front line of, 46,000 of our colleagues are frontline, we also make it for them. Because what we heard pre-2020 is these ERGs and these EBNs are great, but when you have a team that's working on productivity and getting to specimen, they're not able to go to the meetings. And so we did simple things. We record the meetings. We put them in the break rooms. We put monitors within so people can use it on their break time. And then we also put it on mobile phone because some people wanted to use it at home. And so we gave those type of benefits just to try to reach people where they are.
I think,
go ahead.
If I may, just to piggyback on that, the importance of the ERGs cannot be sort of underscored enough, because I think when COVID hit, it was sort of this universal, everybody's affected sort of thing. But even though everybody was affected, we started seeing that it was affecting different folks differently in the ability to work from home, the space that they may have had, the support that they may have had, the care that they had to give, and things like that. And it was really the ability to have representation from all over the place to guide some of those decisions that really, really helped. And then in the return to office discussions, that came in, huge too, because there was going to be a different impact. So even though the initial cause was shared, the impact was very different. And then we set the groundwork really for the ability for the employee to seek that support and that guidance within the professional setting. And now what we're seeing, so the post-COVID is sort of, you've got wars, you've got elections, you've got things that are really impacting people very, very differently. And I think the ERGs, and for some of your organizations, you may not be large enough maybe to have ERGs, but at least being mindful of having representation to speak for everybody involved really, really helps. But it also puts kind of 2 trends, and I don't love the word trend, and that's, I'll switch it with kind of 2 priorities, which is simplicity and equity. And if you want flexibility, well, then you don't always have equity. So you need to have kind of these checks and balances for how much can you be flexible without losing that equity piece, which I don't envy what you do, because that's...
Well, I actually wanted to go to Ivy with that too, because you did talk about equity. And I think that is so important, because we often forget, even something as simple as like, okay, we're doing a lap. Well, not everybody can do the lap. So how are you making sure that everything is equitable? Especially, you mentioned food insecurity. That's a huge thing.
Absolutely. So one of the things that we're doing is we're looking at equity, not only from the health equity perspective, but also from the worker equity perspective. And so when we look at employees, it's not just enough to look at wellness from the traditional, which is, you were losing weight, doing the traditional health things. We're looking at it from, okay, let's look at our entry-level staff or our persons within the system, and we have about 45,000 plus located throughout the New York City boroughs. And so we have an actual program, which is a dietary education fund, and we started looking at our individuals that were in food services. Because in general, when you look at these individuals, these are the lowest paid among our healthcare staff. And so what we did is we started funding them through their education. And just on the way here, interesting anecdote, I was speaking to one of my staff. And so in the last year, what we've done is we've been able to impact individuals that were very in the low end of the salary range. So let's say $40,000, $50,000. And we've actually mentored these individuals, supported them through their education, and our results are starting to show. We have individuals that were service aides that are now nurses. Can you imagine 40,000 and now you're at a 6-figure salary?
Yeah.
So when you talk about food insecurities, when you talk about employee engagement, even well-being, Now you have an individual that may have been feeling maybe isolated, maybe concerned about how they're going to meet their bills. Now this individual is at a whole different level where they feel included in the organization, they feel valued, their confidence level is increasing. And so it's not only a value proposition for our employees, also for the organization. So it used to be, what does the organization want? Now, in looking at the employee holistically, we're looking at what's best for the employee, because at the end, that's going to have a return on investment in our system.
Oh, absolutely. And I love that, because I think that recognition is sort of the unsung hero of well-being. It's so important, and it doesn't cost anything to give an employee recognition, whichever way that your different organizations do that. I want to go back to what is becoming somewhat of a dirty word, RTO. And Ralph, you talked about flexibility, but how that also needs to be personalized. Talk to me about what you're seeing with that, and then anyone else can chime in. I mean, Katie, we know where you're at with that.
I'm R.
You are.
RTO is an interesting one. I'll say from a IPG Media Brands perspective, I think one of the things we did best was very early on in COVID, we actually took that anxiety out of the employees by saying, we are not even going to consider asking you to come back until this point. I think it was January 1. And with that message, it wasn't even, you're coming back January 1. It was, we will talk about it then. For now, through the rest of the year, don't even sweat it and just, kind of chill, because we knew a lot of companies were starting to come back in the second half of 2020, and that was starting to cause anxiety. So the initial anxiety of, I now have to work from home full time, followed by the anxiety of, I now need to come back. So we got rid of that. And then we really focused on listening initially and just asking what's going to work, what's not going to work. And it really prompted a lot of discussions, because within we're a holding company and we've got a number of different agencies. One or two of the agencies are really technology centric. So in the technology world, remote was the way to go before COVID anyway. So now we had all these different sort of things going on with client services saying we need to get back in the office tomorrow. The tech folks being like, I'm never going to work with anyone. Why do you want me to leave my screen at home? So it became sort of almost a benefit as we were sort of rolling out what the policy would be. And then we really wanted to be deliberate in making sure that it was a guideline more so than a policy. And it's a nuance that's very often lost on people who aren't in this room, because that's what we do every day. But where it really makes an impact is in how we enforce it and what the enforceability it becomes. Because if it's enforced with like everybody's checking your key card when you're swiping in and out, you reduce the ability for flexibility. And we had to look at it by job function, job family, by team, by accounts, to see what jobs really needed to be back first, who can come back later. And now we're talking years later, we are pushing back towards, we're at 3 days a week in the office. We're not talking about full-time back in the office yet, but we are seeing that as a benefit. We're hearing of some of our competitors in the space who have gone with the 5 days, losing their employees, and they're coming to us looking for employment or looking for that flexible benefit. So that's become sort of much higher up on the list, whereas maybe pre-COVID, it was a nice to have if you could work from home 1 or 2 days a week, whereas that nice to have has now become a must have for a lot of people. So I think in the way that you think through your policy and the way you communicate your policy and the transparency behind those communications and how you got to that conclusion was something that I thought we did quite well, and something that is scalable.
Jim, you want to
So
your perspective?
I think I'll talk about it from our employees. We're about 2,800 employees, and we were pre-COVID in 2 separate locations, one in Providence, Rhode Island, and one in Minneapolis. And when the pandemic hit, we sent everybody home, and we haven't brought them back together really since then. And it's been a very interesting journey for us all, because one, we started hiring from other places, which gave us opportunities to tap into new pools of talent that we didn't have access to before. We also adapted some of our processes to figure out how can we support people who are not going to be ever in our office in some cases. And now 4 years into it, what we're actually finding is they want to come back. So we're starting to see people come and say, can we have an offsite in the office? Can we come in 2 days a week? But I think, like, whether it be for us or for any of our clients that we talk to, Mandates don't work. Like it didn't work when your parents told you to clean your room. You know, like you did it, but you did it not because you had to, or you did it because you had to, not because you wanted to. And I think what we're seeing now is employers have to have that conversation with their employees and almost leader by leader to their own groups to figure out what works best for them. There is no perfect one size fits all, and it probably won't be a one size fits all forever. So what we've said is let's be flexible in terms of our work. Let's be empathetic to the needs of our clients and our own employees to figure out what best serves them. And let's make it work. It's not impossible. We can figure out how to make this work.
Well, we figured it out.
We figured it out
It's
for
just
4 years,
yeah.
right? But the mandate doesn't seem to really drive the behavior that we've seen leads to better outcomes.
But do you have people on the front lines who have to be there? Ivy and Ebony.
Very
So
different environment.
Yes.
that's a whole different thing. And when we're talking about flexibility, some of the leaders that I've spoken to say that the way that they offer flexibility is doing like shift work or different things with childcare. Can you speak to that?
Absolutely. So one of the things that we've started doing is reimagining healthcare. Obviously, our physicians have to be there, our nurses have to be there, but then we challenge ourselves. We said, do they really have to? And so what we started doing is we've seen an expansion in our business in terms of telehealth services. We've seen an expansion in terms of virtual care. And what we found is that post-COVID, now we rely on a different set of rules. No one wants to go into a doctor's office and have to take a day off. So we've expanded extra care, evening hours, weekends, and we're seeing that staff is gravitating to it, and patients as well. Because again, the value proposition for our staff is, wow, I get to work from home whether I'm a clinician or not every single clinician. But then what it's also allowed us to do is look at clinicians outside of New York to be employed. Because now we can have, and you may not realize this, but when you're in the emergency room and you have clinicians that are reading or radiologists that are reading your materials, because we live in such a virtual world, we can literally have somebody in California reading results for somebody in New York. Mm-hmm. And what's beautiful is that it also creates a value perspective for that person, because if we have a patient being seen at midnight, it's only a couple of hours before, so now we don't have to have somebody working overnight shifts to address the work. Mm-hmm. And then, similar to what Ralph mentioned, what we've done is we've also looked at our roles within the system and determine who can work from home and who has to come into the office. So at this point, we are on a hybrid schedule. And then also similar to you, what we're finding is some people love it, and the people that are home are also feeling a sense of isolation. Mm. So they actually are happy to come in and have the best of both worlds.
Yeah.
So, our situation in the diagnostic world is similar. And where we could send people home, for example, pathologists, there's a lot of digital pathology happening. It's a huge investment, money, but where we've been able to use that money, we've done it. And so we have some of those pathologists that are able to work from home, which also allows us to get the right biopsy to the right doctor. So it's not just the doctor that's close, but the doctor with the right expertise. But in our front line, we just don't have the luxury. You have to touch a specimen, you have to put it, in a machine, and you have to be there to get the readout. And so we had to get our C-suite comfortable with equity, right? Mm-hmm. This job has to be in a lab. This other job does not. And so for that front line, we've done things for them that we don't do. So my DoorDash friend over there, we don't do DoorDash, but we do.
You could,
we could, and we'll talk. But we do things like make sure we have a cafeteria, but we make sure the cafeteria is open, extended hours. During the pandemic, we paid for their food. Non-pandemic, if that's even a thing, because I think a lot of people have COVID. So I don't know what that is anymore.
We probably all have it right now.
That's okay. But we subsidize, so we still try to make it a welcoming place, and we're also transparent. So we don't hide it. That was the thing. You got to just be upfront with your workforce and tell folks what are happening. At the same time, we are bringing our professional staff back. I will say that I do think, as many of us HR colleagues, you do have to have a little bit of courage because, talking to senior executives who aren't always aligned with what the teams want and need. And, it's not always the easiest conversation to say to your CEO, I hear you, and I think
Yes.
we need to look at this. And so where we landed is pre-pandemic, we were 3 days a week in the office, 2 days a week at home. Pandemic, corporate staff, home. 2021, we brought the SLT, so the leaders reporting to the C-suite, 3 days a week. Our teams, 2 days a week. And we have not moved from there. And there's been many courageous conversations with our C-suite because they are ready to move. And we've been able to convince them with our engagement scores. The other thing we did is we set up roundtables with our CEO around the country. So when he goes to visit labs, we take 10 frontline employees without leadership in the room, and we give them the opportunity to talk to the CEO. And what we learned is there is no filter. They say what
They're
they
ready.
mean, and they mean what
They're
they
ready.
say.
Yeah.
And what we also learned is he listened. And he listened with a different ear because he heard it differently from the people he has the highest regards for. He is clear, we do not have a business without these 46,000 people showing up.
Yep, that's true.
And so it's been very, very important and successful for us.
Well, speaking of leaders, and I'm coming to you with this one, they are courageous conversations that you have to have. And the ebb and flow of how this has all worked has been really, really on the shoulders of middle managers, if you will, and all of you here, as I said, you're our frontline heroes. So how does a leader, what is the best practice for having these conversations, keeping motivation up, but also attending to personal needs? No pressure.
Is your question more like interpersonally or more kind of as we're thinking about company policy and setting the guidelines?
Both.
Both. Okay.
So
Well,
do the personal part first.
interpersonally, my personal take, this is not a vetted question, is just honestly like, one, get to know your team first, right? It's hard to have the first conversation be an authentic, tough, candid conversation, right? Like maybe we go for a coffee, just get to know each other.
Yeah. But
Being
that's
in person
important.
helps for that, for me at least, because I really lose energy on the screen. But I do the walk and call for my team that's not based in New York. And I think once you kind of establish that foundation of knowing someone, I mean, I personally have you all have done it, I think, with me, a getting to know you set of questions. I send it to my team in advance because I don't want some people, my husband likes to take time to think about what he's going to say. I don't know what that's like. But I've learned other people are like him too. And so send it in advance. And I say, hey, I just want to get to know you. That's my goal of this meeting as your big boss. And then I get to know you. And it doesn't take a lot of listening to kind of get a sense of someone. So that's the interpersonal.
Yes.
I think from a company policy standpoint, one of the themes that I'm loving from this conversation is you're building a product. Like I build a product, which is DoorDash for Business and our suite of tools. HR leaders, you're building a product, which is your company's benefits program, your culture. Like that is a product, and your audience is really your team and your employees. And your other audience, your buyer, is kind of your C-suite, right? And so I think the best practices for thinking about doing this are the same best practices that I would give to a product team building a product, right? One is just, what's your goal? And your goal cannot be do the same thing as my competitor, because one size does not fit all, right? It depends on your company's objectives, your tolerance for spending money in different places, your decision-making hierarchy, your culture. So first, define your goal. Then second is just test and iterate, right? Try something. If it doesn't work, try something else. That requires a really strong degree of collaboration with your audience. And so the third piece is just make sure you've got those audience touch points, right? I love this idea of the CEO in the room with the front line. I'm going to take it and have our CEO come talk to my support team. I do it with them, but they're going to feel even better when it's our CEO in the room of big DoorDash. So that's one way, right? Survey data is another way. But ultimately, if you've got like a pretty, and actually we do like QR codes, give us your feedback now, right? Do this with our clients too. If you've got real-time data, you're gonna see trends pretty fast. That plus kind of the one-to-one conversations. And then you just keep going until you've got something that feels like it satisfies your objectives. So there's no like answer. I think what's the best practice when we were asking ourselves this question in 2020. We weren't asking about the how. We were asking about the what, right? For us, it was like, well, what's big tech company that we compete for talent with doing? That's the right answer. But actually, I think the best practice is the how. And then the what is really dependent on the company.
Can I piggyback on that just real quick? Because, something that you started with, Katie, and sort of developing that relationship with the person you're speaking to, especially as a manager, and if you're managing larger teams or smaller teams. One of the things that just anecdotally I've sort of learned more recently, and I sort of wish I'd learned it sooner, not everybody wants to talk to you. And that's not necessarily a...
engineers do not want to talk right now.
But it's
They're
also
busy.
not necessarily a testament to your relationship. You could have a great relationship, you can be a great manager, but they're just not comfortable talking to you about that certain thing. And so we've kept it pretty simple on my team to just first ask, right? So if you notice that somebody's struggling or that there's any sign, just ask the question and listen to the answer. And the answer might be that they're kind of sharing but not sharing. And one of the things that I didn't realize was so valuable is just saying, I hear you. Let me share with you all the resources that are available to you so that you can decide what's best for you to get your support. Because if you want me, I'm here. I'm here to listen. I'm always here, but you may not want to. And so that element of like, here are your resources is new to me. And I was shocked at how appreciative the team was because and it took a minute to be like, all right, don't take it personally. They don't want to talk to you. It's not you.
It's just personal.
But I just want to share that because that's something that I learned kind of way later than I think I should have, but I'm glad I observed it.
Go ahead.
And I think the other piece that's tied into that is having the leaders tell their own stories. So if they can get out there and say, hey, here's where I was struggling. Here's where I went to go get help. It opens the doors for others to say, okay, if that person went for help, I can go for help. The last thing I'd say, it's also really important to talk to your C-suite or whoever's making your financial decisions about the investment of well-being and wellness as opposed to the cost of healthcare. So on average, our clients spend about $600 per employee for well-being. They spend about $13,000 to $18,000 for healthcare. So where do you want to make that investment? Because you can easily spend a little bit more on the well-being side and have a significant savings on healthcare costs because while they're doing great jobs, they need to get paid more and that's going to drive up healthcare costs. So that cost is going to go up just significantly higher and faster than anything that's there. So it's just about, can you do more with less? Can you get your leaders involved? Can you be empathetic and can you personalize it?
On that note, we are out of time. So flexibility, personalization, empathy, and being vulnerable. Those are the takeaways that I got, and I hope that you all got some great insights as well. Ebony, Ralph, Ivy, Jim, and Katie, thank you so much for being with me today.
Thank you for having me.
Give them a hand.